This session is on sexually transmitted infections, also called STIs, also called STDs for sexually transmitted diseases. Formerly were referred to as VDs for venereal diseases. But sexually transmitted infections are the single most important cause of reproductive disorders. And infertility problems, the first thing they're going to check is for your STD status. Okay, the first we're going to talk about is gonorrhea. It is a bacterial infection, and bacterial is very important because bacteria can be cured with antibiotics, even though there can be resistant strains. You may have to use different antibiotics. Gonorrhea infects mucous membranes, reproductive system, urinary tract. Any infected mucous membrane can become a source of infection for the other person. Genital, anal, pharyngeal mucosa, as in throat, mouth, can all be sources of infection. Signs and symptoms in males: urethritis, painful urination, discharge of pus. Females, 20% have no symptoms at all. Some have, so 80% do. Abdominal discomfort, vaginal discharge, abnormal bleeding, and big deal, can result in pelvic inflammatory disease and sterility. And pelvic inflammatory disease is worse than just a sterility thing. You get pain and adhesions. But the worst thing is that within that fallopian tube, we'll make this be a fallopian tube here, and this is where your fertilization takes place. If you've got scarring here, this is going to be our uterus side, this will be the ovary side. And so we have scarring in here. The sperm can get through, and this happens with syphilis too, pelvic inflammatory disease. The sperm can get through, and so you have an egg, it gets fertilized. Now, I'm not very good at drawing circles here. But this can be our little developing embryo. It can get stuck right here, and then you have an ectopic pregnancy. And because you've got all kinds of vascularity, I'll draw it blood, along these ovaries and tubes, as this gets bigger and bigger and bigger, it can cause rupture of these blood vessels and the woman can bleed out. So severe abdominal pain in a female of reproductive age, it's very important to consider that they could have an ectopic pregnancy and it could get bigger and bigger and bigger. If it ruptures, they may die. And they may die now. There's die now things and there's die later things. Okay, there are resistant strains, but generally you can find something that will totally cure gonorrhea. This is the most horrifying picture. You'll find this anywhere you look up conjunctiva and gonorrhea. It can affect the conjunctiva. I sit there and I think, I want to say don't look too closely where you're not supposed to. But anyway, however it happened, this person got gonorrhea in the mucous membranes. And if you come around with an eye looking like that, probably not going to be spreading it to many people. But that's horrifying, and that's going to systemic antibiotics as well as the topical eye drops. Okay, the next is syphilis, and we've already discussed this in our discussion boards in lab to some degree. But this is another bacteria again. The thing that's so sad is it can be treated in the early stages with one single shot of penicillin, benzathine penicillin. Now, if you're allergic to penicillin, they're going to have to find something else that works for stages. It can be transmitted sexually or congenitally. That means you can give it to your baby when you're pregnant. Fetuses are going to be stillborn. You may have miscarriages, at very early stages, or they can die shortly after birth, or they can have brain damage later. I mean, at birth and live and just not be right. And infection is going to typically be asymptomatic for 2 to 3 weeks. Then you get a painless canker, the site of infection, that then clears up on its own. Now, if you're male, you probably are going to see a painless canker sore. But females, there are parts of one's anatomy that one cannot look at readily. So it may be completely unnoticed. Okay, now the secondary syphilis is going to cause a skin rash. And I think the only thing to do is to go to the next slide. If you have been very naughty and had been somewhere you shouldn't have been, and weeks later you come up with a rash, especially on your hands and feet like that. I mean, not many things are going to cause a total body rash. It's time to go get a checkup. Now, this is secondary syphilis. It's going to be 3 to 12 weeks after the initial signs disappear. So it may be, so you're talking 3 months out. And then it may go latent, just go dormant, and not progress to tertiary syphilis. Might be a year, might be many years. There are cases of people who have carried it 30 years with no signs, and then as they get very old and their immune system gets bad, it causes central nervous system issues, blood vessel issues, bone and skin issues. These lesions or gumas are the basically just actual lesions in the brain, and that is why it can lead to dementia. Some nursing homes have a syphilis test as their minimum database, and there have been people who have not been sexually active for 20 years who are diagnosed with syphilis, which is a little disturbing to their families. Okay, there's our secondary, and this is our tertiary, and I put this here just kind of, I could see somebody being insane and they're swinging from the rafters in a straitjacket, but that's not really what happens with people who have brain damage. You think of dementia or just not as sharp as they were, and treatment is going to stop the progression, but once you destroy brain tissue, it's destroyed and it's not going to get better, but you can prevent it from getting worse. Okay, chlamydia is the next STD we're going to talk about. Again, bacteria, very small bacteria, and chlamydia, there are several species, but we're going to talk about the one that causes sexually transmitted infections. Responsible for 25 to 50% of all cases that are diagnosed of pelvic inflammatory disease. Now, you remember I talked about pelvic inflammatory disease and ectopic pregnancy, so that is a real serious problem because it could kill you. Symptoms, urethritis and penile vaginal discharges, abdominal, rectal, testicular pain, painful intercourse, irregular periods, can cause arthritis, urinary tract infections in men and no doubt in women, infertility, sterility in women, easily treated with tetracycline. But back to the other thing, if you've already got scarring in those fallopian tubes, they may be scarred and you may either be fertile or worse still, have an ectopic pregnancy where the sperm goes up the fallopian tube, the egg comes down, they meet, you get a fertilized embryo, starts growing, you get a zygote, and then it develops and it gets bigger and bigger and bigger, and then it can rupture through the vascularity, and once that happens, your patient can bleed out there. And it's a die now thing. They can die very rapidly. Okay, trichomoniasis. This is one of the most common sexually transmitted infections, and I always thought that it was just from having sex. Risk factors: multiple sex partners, not using condoms during sex. People, they're having cases of people catching it from hot tubs, public hot tubs, like at a hotel. And that makes me never want to get in another one. That's kind of frightening. But in females, men may have no symptoms. But in females, foul smelling, fishy smelling, vaginal discharge, genital itching, painful urination, and they say that it smells like rotting fish, and it can be a green discharge. Let's see, can we find green? Green. So what I have to say about this is, one, I'm glad that I'm married and in a stable relationship, and two, I'm glad I don't work on humans. But it is caused by a protozoan, and a protozoan is a single cell organism, but it's eukaryotic. That means it does have a nucleus much larger than a bacteria, and it's called Trichomonas vaginalis. There are other Trichomonas organisms that cause things like eye infections in South America. Totally different. This is the one that's STD. Now, I added these on. This is a photo. These are both photomicrographs. This is a blown up one with stain on it of what the organism looks like. It's got the little nucleus here in the tail, and this on this page here, this actually looks like it's not taken with a regular microscope, but with an electron microscope. These are the human cells here, the ones that look like this. And the reason I say it's an electron microscope is because you see so much detail in that cell. Bacteria are going to be this size, these little guys here. See the little dots there. This is your Trichomonas. See the tail on this one? I'll outline this guy. I'm really bad with this because I'm using not a pencil, which I should be able to get one, but I haven't. That's the tail on it. And this was just an arrow. And that is a mistake right there, that. Okay, so here's bacteria. So you might expect syphilis or gonorrhea to be that size. This is a human cell. This is a trichomoniasis. And though I've never seen them because they're not in species that I deal with as a veterinarian, but they say they swim. Now, if you see large swimmy things going across a vaginal smear, you got your diagnosis. And it is treated with antibiotics. They generally, I believe, use metronidazole, which is Flagyl, is one of the brand name. And I don't have a clue on the dosage. Okay, viral infections. First one we're going to talk about is genital warts caused by the human papillomavirus. Now, it's sad to get a wart on your parts, but the worst thing is cancer. Definitely causes cancer. It can cause cervical cancer, it can cause cancer around the anus, it can cause cancer of the throat. I just recently learned that on the news. And it also, I don't know if I mentioned penile cancer, cancer of the penis. But there is a vaccine, and it prevents the varieties that cause cancer. And I want to go to my next slide. This is a part of a penis. They didn't show the whole thing, but that's a wart. Just the wart itself is enough to make you want to get the vaccine. But these can become cancerous. And in the female, it's on the cervix, so you won't see it there, and it develops on into cancer. And that's one of the main reasons they do the Pap smear every year on women, is to detect early cervical cancer. Because if you remove that cervix in the early stages of the cancer, you're fine. Now, I have no idea how it can possibly be a debate, but I've had students say, ooh, I wouldn't dare get my little children that. I think they start at 9 or 10. It's boys and girls now. Ooh, I wouldn't dare get my kid one of those shots. That'll just teach them to be promiscuous. No, they're going to be promiscuous when they get to be adults because that's the society we live in. And when they're adults, it's their business. It's your business to take care of them. As children, you say, well, if they know they've got it, they'll start having sex earlier because they've got a shot against cancer. They have a shot against cancer. And you ask them, they say, well, what kind of shot are we getting? You say, a vaccine shot. Well, what kind of shot? The second one is, it's a booster shot. And that's enough. They don't need to know anymore, and they won't ask, most likely. And if you ask them what kind, you can tell them it'll prevent cancer someday. Okay, next viral infection. Oh, and I should have mentioned on this, there's no cure for the virus. The vaccine might be efficacious against existing warts, but once you have the cancer, you're going to have treatment for that cancer. Because viruses, we don't have good antivirals. We have mediocre antivirals. But genital herpes, this is a disgusting little disease, generally caused by herpes type 2. Latent periods can go on for even years, and then you get flare-ups. Now, one big deal, congenital herpes. The fetus is born with defects, or the fetus dies in utero. It's very bad to be pregnant and have herpes, so they would put you on medication. That's another reason to go to the doctor if you're pregnant. Now, they have acyclovir and I don't know what other antiviral drugs, because this is, again, a disease I don't deal with. Now, you have two types of herpes simplex virus. Herpes simplex 1, and you notice this word usually is on the mouth. Here's somebody who's got it in their eye, and you could get it from scratching that sore there and scratching your eye. But it sits dormant in the nerves that innervate the mouth, and then when you get stressed, it comes back out and gives you these cold sores or ulcers. And so if you have ulcers in the mouth, so I was told there's 3 things it could be. Herpes, which is probably very common because people kiss babies on the mouth and you get infected as a child. If somebody kisses your baby on the mouth, sock them. Don't let them kiss your baby on the mouth. But it goes dormant and it comes back when you're stressed. Allergies to food could cause ulcers in the mouth. There was one other. I forgot what it was. Here's the sad thing. It can cross the proverbial belt barrier. Now, a belt barrier, everybody knows you wear a belt. And this is the north side of the belt barrier, so one can guess where the south side of the belt barrier is. If your partner has that on the north side of the belt barrier, you don't want that on your south side, which we'll get to here in a minute. And I just read this just the other day. You can give it to yourself. Rub your mouth, don't scrub your hands thoroughly, and then rub other parts, and you can transfer it to yourself. That would be sad to get a sexually transmitted infection from yourself. But this is a genital herpes. This is the underside of a penis and a really disgusting flare-up. Inner thigh, here's what's the problem. It could be on the thigh, the buttocks. And if it is, this little blister breaks, and you're having sex with this person who has these blisters, and this breaks, what good is a condom going to do you? That's going to get on you, and it could make its way up into your genitalia, and then you have herpes, and you don't get over it, and you take medication, but you basically, for the rest of your life, have herpes until they come up with a cure. Okay, HIV/AIDS. HIV is a virus that causes AIDS. It attaches to CD4 cells, which you should remember from the lecture on the immune system, become T helper cells. T helper cells. And without the T helper cells, they are the basis of your immune system. So without them, you're not going to have a good immune system. And this is when it was first discovered, it was a problem of people getting weird cancers and weird pneumonias. And it was discovered, I think in the 80s, really wasn't much known about it to the general public until then anyway. But it did exist as far back as in the 1950s, because there's some frozen blood that was in Africa. Now, people want to say, well, where did it come from? Most likely it came, and I have cracks and pops in this thing because my microphone goes off. But okay, bushmeat, that's wild animals. Now you say, ooh, I wouldn't eat a chimpanzee. Now, you don't get it from eating the meat that's cooked. You get it from cleaning the meat and getting the blood in a scrape on your hand or whatever. So just like you would get it from a person, blood from the animal goes into you. Now you say, ooh, I wouldn't eat a gorilla. But if your children are starving to death, you'll feed them what you can get. And this is what some of the people in Africa were faced with some major famines back around the time this happened. So bushmeat is meat that was not meant to be eaten, sort of like bats. We don't need to eat bats, and we're facing that. That's why we're on the internet today. Okay, transferred by sharing bodily fluids, as in having sex. IV drug use, and it's not uncommon. You use your heroin, you let the next guy use the same needle. Now, I'm not one to encourage this, but if you're a heroin addict, and please tell me you're not, I'm telling you this for your educating your patients later, but they can go down to Tractor Supply and get a box of needles or syringes and needles and use new ones for their heroin. Then they just have to worry about overdose. Blood transfusions. This, before they started testing for it, it was quite common. But now every blood sample is tested for AIDS. And if you have any known risk factors, they're not going to take your blood. One is getting a tattoo recently, within the past year, I think. And the blood is always tested that they take for blood transfusions as well. But if you've had a tattoo recently, they won't take your blood, which is kind of scary when you think about getting tattoos. And tattoo personnel, people who do tattoo artists, that's the word, should know to use only sterile technique. But it is conceivable that some of them do not use sterile technique. So they do a tattoo on a guy that has AIDS, and then they do a tattoo on you and transfer it to you. Okay, this is where most healthcare workers get burned, right here. Accidental needle sticks during a medical treatment. You say, how can that happen? Well, it happens, especially if you're handling children. It happens to humans all the time. I mean, to veterinarians all the time, working on animals. Because, little doggies, I'm just scribbling that just for no reason. Doggies wiggle around and bounce, and you end up sticking yourself. But if you're exposed at work for whatever reason, a kid kicked you, an adult went psycho and kicked you or bit you there, grabbed the needle and jabbed it in you, whatever happened, what you do initially, and it's not kill the patient, allow the area to bleed as much as it will, scrub it with soap and water. If it's a bite wound, do it anyway. Then, this I cannot overemphasize, fill out an incident report. Some places will say, oh, you don't need an incident report, we'll take care of that. No, they won't. HIV stuff your insurance may not cover if it happened at work. You want that workman's compensation. So they'll do an HIV test on you first to be sure they're not paying for something you've already had. And hopefully the patient will agree to give blood for the test. Now, they're not legally required to. I've had students say, oh, they'll give it. But anyway, it's not legal to kidnap their dog or their grandma or something until they give the blood. You have to talk them into it. But if you've been exposed, you'll be put on medication that should protect you. You'll be put on medication that should protect you from getting infected, and therefore it will take care of the problem and you won't get sick. But you've got to fill out that incident report. There's nothing more important if you're exposed. Any questions, just either email me or put it on a place in one of the discussion boards. That's always a good way to communicate with your colleagues and with your classmates and with me. Okay, that's all for now, and okay.